So I wasn't around, I got invited to teach that we had wanted to because.
Ready to go?
Yeah.
Okay. Welcome, everybody. I'm Jim Karinji, professor in the School of Public and Community Health Sciences. I'm happy to be here today for our seminar to introduce our speakers that are going to be talking about Montana's Morel mushroom outbreak and lessons learned, probably something you've heard about. And we can get the real scoop today. So I want to welcome Heather Demorest from Gallatin City County Health Department, who will be virtual today, and Rachel Hinnenkamp, who is at Montana DPHS. So thank you for coming.
Well, thank you so much for having us present here today. Like Jim said, I'm Rachel Hinnenkamp. I'm the food and waterborne disease epidemiologist with Montana DPHS. And I'm joined here today virtually by Heather. So Heather, I will turn it over to you for an introduction.
Okay, hi everybody. My name is Heather Demorest. I am a communicable disease specialist at the Gallatin City County Health Department. And essentially, just to give you guys a brief overview of my role, we have over 70 reportable conditions in the state of Montana. And my role is to follow up on those when they are reported within our county and implement whatever measures might be necessary to control the spread of disease within our community.
And Heather and I work closely on a variety of illnesses. So just for some background on kind of how the public health system is set up in the state, although I know many of you are probably pretty familiar with it. We have a decentralized public health system. So at Montana DPHS, I'm with the state health department, and we work very closely with our almost 60 local and tribal public health departments. And how responsibility for disease investigation works is that the local public health jurisdictions, like Heather, are responsible for investigating the diseases in their community. DPHS is always there to assist and answer questions as needed. But then when larger events like the outbreak that we're going to talk about today happen, there can be a lot of cross-jurisdictional investigation. And that's when DPHS takes on more of a role in the outbreak investigation. So as an epidemiologist, I kind of like to describe my role as a disease investigator. And basically us at the health department at all the different levels are really just trying to investigate disease and stop the spread and keep the public healthy.
Okay, so to get into a little bit of a timeline of events, I always like to kind of have the caveat that when it's an outbreak situation, it's very rarely a perfect linear response. There's a lot of things happening at once, but we try our best to put it into timeline format. So to start with, on April 18th, we received 2 complaints of illness. Really promptly, these were reported to us, which was kind of a huge benefit for us to start our response very quickly. One individual was hospitalized with severe illness after eating at a sushi restaurant in Bozeman on April 17th. And later that same day, we found out about another individual who was found deceased in their home after eating at the same restaurant on the same day. So with any consumer complaint related to a restaurant, we always take it very seriously and promptly conduct an inspection to see what might be going on at the facility that's causing illness. So this was no different. Our local sanitarians promptly went to the restaurant and conducted an inspection. And following that inspection, the restaurant was temporarily closed due to potential ongoing risk to the public. We continue to learn of other cases of foodborne illness associated with the restaurant. To begin with, those were primarily reported to us by the restaurant. That's pretty typical in foodborne illness outbreaks, where people will call the restaurant where they felt they got sick and report that way rather than calling the local health department. And during the inspection, we also learned that the restaurant served a special roll on the 17th that contained raw salmon, marinated morel mushrooms, and other vegetables. And we knew, at least with our hospitalized case at this point, that that was the roll that they consumed. So that was a food item that we were pretty suspicious of from the outset. And then on the 19th, MT DPHS reached out to the CDC and FDA partners for both notification and also to ask for some assistance in this investigation. Like Rachel mentioned, we often have a lot of cross-sector collaboration. We don't include the FDA and CDC on all of our foodborne illness outbreaks, but in this instance, with these severe outcomes from the outset, we really wanted to make sure that there weren't people at risk in other states or other jurisdictions. And we also consulted with the Rocky Mountain Poison and Drug Safety for guidance on the investigation. They're a really great resource, especially when you're dealing with something that is unknown and leading to these severe outcomes. Both the provider and the state health department were consulting with them. So early in the investigation, we had our suspicions, but there's a lot of different factors that you have to consider, right? So at this point, from the case reports we'd received pretty early on, we knew that it was a very short incubation period. And typically with foodborne illness outbreaks, people always think it's the last place they ate. Very often that's not true. Most foodborne pathogens do take a little while longer to incubate or to result in illness. But in this case, we did find that it was a very short incubation period, with most cases becoming symptomatic within an hour of dining. So again, that's not typical for most foodborne pathogens. And we also knew that some cases resulted in severe illness and death. So really severe outcomes from the outset. And with it being a sushi restaurant, of course, we were concerned about raw fish exposure. So things like ciguatera fish toxin or C. perfringens, like these really severe foodborne toxins were definitely on our radar. However, we also knew that most of the cases that were reported to us up to that point had eaten the special roll, and morel mushrooms were the only thing that were unique to the special roll. The salmon had been used on various other rolls, for example, but morel mushrooms were a really unique ingredient, and many cases at that point had eaten the morels. And they were also a new ingredient for the restaurant. So that was just something that was very interesting from the get-go. Most of our cases were symptomatic with vomiting and diarrhea, which fits with something like a foodborne toxin. And at this point, we knew that the morels had been marinated, but really didn't have a lot of information on the preparation process. So continuing our timeline, we learned through traceback information that the morels and salmon, the morels had been cultivated. And so they were farmed in southern China and then shipped to the US. That's pretty typical actually with morels that are cultivated. And we learned that kind of throughout this investigation. Rachel's going to talk more about morels later, but that was kind of an interesting thing. China is one of the few places in the world who has learned how to successfully cultivate morels. So that part wasn't particularly unusual. And then we received additional complaints at that point, both from the restaurant and people were reaching out to local public health pretty early on. This outbreak gained a lot of social media attention, so that kind of benefited us in the way that it was on people's radar and people were very willing to report illness to us. And the state public health laboratory also received food specimens on the state. So we collected food samples from the restaurant based on the illness reports we'd received to that point. So that was the salmon and morel mushroom debris that were both served on the special roll. So to just kind of explain what we mean by morel mushroom debris, that wasn't the prepared morel mushrooms that went onto the special roll. Those had been discarded, unfortunately. So we were only able to test the remaining morel mushroom pieces that were at the bottom of the original packaging. But both of those were sent up to the state public health lab to be tested later, and the restaurant remained closed under health officer order. So to give you guys a little summary of what our cases were looking like up to this point, this is from our line list data. Anytime you have an outbreak, line list is a very handy tool. So we identified a total of 51 cases, 3 hospitalizations, and 2 deaths associated with this outbreak. Again, the onset of symptoms was really rapid with a median onset of 1 hour after the restaurant meal. We did have a bit of a range, especially with that many illnesses reported, with the lower end being within 15 minutes of the meal and the upper end being 20 hours after the meal. But again, most cases reported illness within an hour of their meal. And the most commonly reported symptoms were diarrhea, nausea, and abdominal pain. We initially we were trying to figure out if neurological symptoms might have played a factor because, again, we were concerned of some sort of toxin. So we were asking about those as well, but they weren't very commonly reported among cases.
And then a little bit on morel mushrooms. So this is kind of what we knew and what we learned as part of this investigation. And I will preface this by saying that this was done by, like the epidemiology and public health side of the research. So we are not mycology experts. We did consult with some people who knew a little bit more about mushrooms. But this was just, how morels were known to have impacted human health so far. So what do we know? We know that morels are a type of edible species that are often foraged from the wild. A lot of people in Montana spend a lot of time foraging morels in the spring and summer months. And as we learned, they are sometimes cultivated. So like Heather mentioned, not many places have learned how to cultivate morels, but southern China was one that had a pretty established morel cultivation system. They're in the Morcella genus of species, or the Morcella genus of mushrooms. And these are true morels. If you know anything about morels, you've probably also heard the term false morels. So this is not a type of actual morel, as the name implies. But they are fairly similar looking to true morels. But we do know that false morels can cause illness in humans. They can cause similar GI symptoms, potentially lead to death. And they are actually the Gyrometra species. There was also a lot that we found out that we being the whole like public health realm, mycology, toxicology realm, that there's a lot we don't know about morel mushrooms. In all of our research, and we were doing research with the CDC toxicologists as well, we found some news articles that mention morels and illnesses related to consumption of morels, and journal, but no real scientific or medical literature that mentioned this. So while there was some information out there, it was pretty limited, and it was not from any type of, like medical journal or true scientific article. But we did find that the toxins in morels that may cause illness are not fully understood, but cooking them properly is found to, or is thought to, reduce the risk of illness in humans. So I just wanted to include some snapshots, not that you necessarily need to be able to read all of this, but this is just some examples of articles we found, just kind of recounting illnesses and outbreaks that occurred after consumption of morel mushrooms. So the first one that you see up there on the left took place in Canada in 1991. So again, it's not super current, it's pretty outdated information, but it's what we had to rely upon as we were trying to learn more about this type of mushroom. And there was a banquet there where a salad was served with raw morels served on the salad. And after that situation, 77 people became ill after eating those morels. We didn't notice in that information that we were able to find that there were any deaths associated with that, just that 77 people became ill with similar symptoms, nausea, vomiting, diarrhea. On the right, there is a more serious outcome from what we were able to find, and this is in like a fungi journal that we found. But in Argentina, there was a family who foraged morels, and it was a family of 3. The 47-year-old father consumed the highest amount of morels. He became sick pretty quickly after consuming them and had, again, same GI symptoms and ended up dying. The rest of his family, his wife and child, had fewer morels and did get some symptoms, but ended up okay. So already we're kind of seeing the short incubation period, the severe outcomes that are possible, potentially a dose response. The more people are eating, the sicker they seem to be getting. And then for the morel specifically from this outbreak, we knew that they came from southern China and then were imported into the US. They were received at an importer in Northern California, where they were sorted into size and packaged up, sent to a distributor in Southern California, where they did a little more repackaging, and then from there they were shipped to restaurants across the United States. So as you can see, the morels made it to a restaurant in Bozeman, Montana. They were packaged in plastic bags on ice. When we were talking to our mycology expert about this outbreak, she suggested that having them in plastic bags is not typically a recommendation for mushrooms of any kind, and that she would recommend that they are stored in paper bags. So just kind of another interesting note that we found during the investigation. We also knew that the mushrooms had gone to quite a few other states and other restaurants. So at that point in the investigation, we knew that we had cases in Montana, but we also knew that the mushrooms went elsewhere and hadn't heard anything about cases elsewhere, but didn't know that for sure. So we're really curious, and it really was interesting for us to try and figure that out so we could determine if there was, you know, some kind of contamination at the source or throughout the shipment that maybe was leading to illnesses, or if this was a specific handling issue at the restaurant, specifically in Montana, that was making people sick. So in order to get a little bit more information on this, we worked with our FDA colleagues and our environmental health colleagues in another state to do a little more traceback information on the morel mushrooms. The restaurant in Bozeman was the only place in Montana that had received morels from this specific location. So we had to kind of go beyond the state's borders to learn a little bit more about the other facilities that had received them. So one state in particular knew of 12 facilities in their state that had received morels around the same time frame from the same distributor, from the same, you know, location in southern China that had cultivated these morels. And when I say facilities in this situation, it was 11 restaurants and 1 catering company. So all, you know, involved in preparing food and sharing with the public. So the FDA in that state reached out to those facilities and asked them, you know, about their preparation methods, about any potential consumer complaints that would have maybe come in after eating this specific food item. Half of the facilities responded, so 6 of them responded, and none of them had any patron complaints, no known illnesses associated with consumption of the morels at their facility. And we also determined through that investigation that all of the restaurants and catering company who responded to the inquiry fully cooked their morel mushrooms before serving. So whether that was sauteing or frying or some other type of heating, they were thoroughly cooked before they were served, and no illnesses came of that.
Okay, so at this point in the investigation, we just really wanted to see what kind of information we could get from the epidemiologic data. So we had our line list, and from that, we knew that most cases who reported illness also ate morel mushrooms. And they had symptoms that we would expect to see with morel mushroom toxicity, but we wanted to learn more. And just to kind of, I know most of you on this call are probably have a public health background, but just to give a quick broad overview of what a case control study is. It compares the exposures between people who did get sick or cases and those who did not get sick or controls to determine if a certain exposure, which in this case was the food consumed, is more strongly linked to illness. So getting into our case control study, we were able to interview 41 cases and 22 controls, which may not sound like a ton, but it was very, very time intensive. We called all of these people and did the interviews over the phone so that we could control for the way that the questions were answered, making sure that all of the questions were answered and that the answers were coded correctly so that we could do data analyses. So it was very time intensive. And for the purpose of the case control study, a case was defined as someone who experienced diarrhea, nausea, vomiting, or abdominal pain after eating at the restaurant between the dates of March 27th and April 18th. So we asked about consumption, amount, and modifications for every menu and off-menu item. So for those of you who are familiar with sushi restaurants, there is a lot of personalization involved in menu items a lot of the time. In this case, it was a very extensive menu, and there was also a secret menu, which a lot of locals are familiar with, but is not published. And then there's also a chef's choice roll and a daily special roll as well, typically every day. So we had a lot of food items to ask about on this study. Then getting into some of our findings. So we found that the odds of eating morel mushrooms in either the special roll or chef's choice roll among cases were 10.77 times higher than the odds of eating morel mushrooms among controls. So for those of you who are familiar with odds ratios, anything above 1 is statistically significant as long as the confidence interval is what it should be and all of that stuff. So a 10.77 times higher odds is very high. That's pretty indicative that the morel mushrooms were indeed the food item that was getting people sick. And then we also found that there was a bit of a dose response relationship going on. So that meaning that the more pieces of the sushi roll with morels that someone ate, the higher the odds of them getting sick. More specifically, it was a 1.92 higher odds per one piece increase. So that was another thing that was just really interesting for us to learn. And then we were also able to look at the impact of cooking on illness. So again, the morel mushrooms were a new ingredient to the restaurant and were served on multiple days in late March and through April, up until the restaurant closure. And we were able to use 2 dates as kind of a proxy for cooking status because the restaurant supplied us with really detailed information on the 2 dates on how the morels were prepared. We know they were served on other dates, but we didn't have that specific preparation information. So that's why we compared these 2 dates. So on April 8th, we knew that a sauce was boiled and poured over the raw morels, which then marinated for 75 minutes before being added to the special roll. So they underwent some sort of cooking process there. And then on April 17th, they were served completely raw as part of the special roll. So through that, we found that consumption of the special roll with morel mushrooms was more strongly associated with gastrointestinal illness on the days when the morels were served completely raw, which was, again, the 17th, compared to the day when they were partially cooked on the 8th. We also found that most of the severe outcomes, so most of the hospitalizations and the 2 deaths that occurred were also related to or associated with the 17th when they were served raw. So this is just a nice little depiction of that dose response relationship that we were talking about, and also just to show the difference in the number of cases comparing those 2 dining dates. So both on April 8th and on April 17th, there was that dose response relationship where the more pieces of sushi that a person ate, the more likely they were to report illness. And you can see the dark gray represents cases, the light gray represents controls. So definitely saw more cases with more of the sushi roll that people ate. And then this is a nice little timeline to just show when the morel shipments were received compared to when they were served and the reports of illness. So on the 1st, that's when we know that a roll with morel mushrooms were served based on patron reports, but we weren't able to confirm that with the restaurant. And you can see that there's a spike in illnesses there. And then morel mushrooms were received again, and there's another spike in illnesses on the 8th when they were partially cooked. And then on the 17th, we had our overwhelming majority of cases when the mushrooms were served raw.
And then just a note on public messaging, for those of you who are in public health, there always seems to be a thin line of when do we go public with this information. We of course want the public to stay informed and know of the risks that are associated with illness and if there's actionable information that they need to be aware of. But we also need to make sure that we have enough information to share and make sure that it's the appropriate and correct information to share. So we need to make sure, that we have our ducks in a row before going public with information. So that was always a big, certainly a big part of this outbreak. So here's what kind of we ended up going with. But at the end of April, on April 26th, we sent out an EpiX call for cases. And for those of you who are unfamiliar with what this is, it essentially is just a notification system between health departments, local, state health departments across the entire country. CDC is involved in that as well. So we sent out an EpiX call for cases to see if any other states, again, had received any complaints of illnesses after eating morel mushrooms. And along with our FDA traceback information with other restaurants that received the same product, we did not get any additional reports of cases. So just another piece of information indicating that, okay, what happened probably was unique to Montana and what was going on at that specific restaurant. A couple days later, on May 3rd, we put out a joint press release between Montana DPHHS and the Gallatin City County Health Department, describing the outbreak and the mitigated risk to the public. So letting people know that the restaurant was closed, that the morel mushrooms were a suspect item in the outbreak, and that we were continuing our investigation into this specific food item. On May 19th, since we were continuing to work with our federal partners, the FDA released some information in a public health advisory, specifically on morel mushrooms. We have a lot of food preparation guidance for other types of food. Like everybody knows that we need to cook our poultry to a specific temperature and our pork to another temperature. But we don't have that kind of laid out information for morel mushrooms or other wild type mushrooms. So because of this outbreak, FDA really felt that it was necessary to put something out as a public health advisory for both morels and other wild type mushrooms. And they did include general guidance in there saying that cooking morels is thought to reduce the toxicity in them. And then 2 months later, we did another joint press release between Montana DPHHS and the Gallatin City County Health Department. This was after we had gotten the results of our case control study and looked through the data and really found that, okay, there is this association between eating at the restaurant and eating morel mushrooms, that the cases ate the morels, the controls didn't, and that the day when they were completely uncooked, we saw more illnesses compared to the day that they were partially cooked, and then also that dose response. So we felt that we had enough information at this point to do kind of a final press release, closing the outbreak, summarizing the cases, but also putting together the information, sharing this, the results from this study, and letting people know that cooking morels does have an impact on human health and illness. And just because, we do, like I mentioned before, we do know that there is a culture and history of foraging morels in Montana. So beyond this outbreak, felt that it was really important to get that messaging out there. I'm sure most of you have heard about this outbreak before today, but there was a significant amount of media coverage of the outbreak, especially in Gallatin County, the local community where this was all happening. So there was a lot of local attention in the news, on social media. There was a lot of community chatter, specifically on Reddit and Facebook. So the Facebook page for the restaurant got a lot of comments and interaction. And one good thing about this community engagement and attention is that we really do think that that probably led to a lot of engagement with our interviews. So when we did go to interview cases and controls for our case control study, people had heard about the outbreak, they wanted to help, so they were pretty willing to interact with us, and we had a very high response rate, which doesn't always happen with public health, so that was nice.
Okay, so when we're talking about an outbreak in a perfect world scenario, we have our epi data, and then it's also supported by our clinical and food specimen testing. And in a perfect world, those all line up perfectly. So in this instance, of course, we were trying to get clinical specimen testing on individuals who were ill, along with the food specimen testing that I mentioned earlier. And so in our clinical testing, no causative agent was identified, even though we did some extensive clinical testing. And when I say we, I mean primarily the providers of the hospitalized patients. And then we also had some coordination happening with individuals who were still reporting illness to get some samples from them as well. So in our clinical testing, it included urine amatoxin testing, total urine arsenic level, gastrointestinal panels, and culture of stool specimen, along with standard clinical labs used for medical management, which might include liver enzyme tests, blood work, etc. And through all of that, we weren't able to find a clear pathogen. And then we also had our food testing. So I mentioned earlier that we tested the salmon and morel shakes or morel debris. And they were tested and found negative, unfortunately, for various toxins, heavy metals, pesticides, volatile and non-volatile organic substances, and pathogens, including ones that we were highly suspicious of, such as C. perfringens, B. cereus, and staph enterotoxin. But the kind of caveat I want to put with that is, even though they were completely negative, that can happen sometimes, especially when you're talking about toxins, which I am not by any means an expert in, but through our consultation with the CDC, they mentioned that it is difficult to test for toxins in food and clinical specimens, and often they aren't identified clearly. However, we did find through DNA sequencing that the mushrooms that were used in the special roll were in fact true morels, or I'm sorry if I butcher this pronunciation, Mortella sextulata. So that was, we were able to find that piece that they were indeed true morels that were served.
And then we also could not have done this outbreak investigation without support and help from our federal partners, so mostly the CDC and FDA. So the CDC involvement, we worked with them on a near daily basis. They have a medical toxicology team who we shared, information about the outbreak with, and they helped us do the background research on trying to figure out if they could find any articles in the scientific literature on other individuals who had consumed morels, raw or cooked or otherwise, and the human health impacts from that. This outbreak was very intense and very busy, and was getting a lot of attention. So Heather's team and my team, we were really just kind of, focusing on interviews and answering questions from the media and everything like that. So it was really, really helpful to have, the other teams in the background kind of doing that research and supporting us and sharing that information with us. So yes, thank goodness for Microsoft Teams with our weekly and almost daily video meetings with them. And they also helped us with the analysis on the case control study. So the Montana teams, both state and locally, we did the investigations and cleaned all the data and entered the data and everything. But the CDC, as though their team was able to help sort through that data, analyze the data, get us our nice odds ratios and everything like that. So that was really helpful. The FDA involvement was huge as well. Like I mentioned, there's not a lot of information out there on morel mushrooms and the public health concern that morels tend to be, or were at least in this outbreak. So they wanted to know a lot of information about our outbreak as well. We had typically had our meetings with the FDA core team, which core makes it sound small, but it was typically like 50 to 80 people. So it was a huge number of people involved. So we would meet with them on Friday or every other Friday to share updates on the outbreak and everything like that. They would be doing their research, and it was really interesting to hear how the process went of, what do we do about morels? What kind of public messaging do we put out? And like I mentioned before, they posted their advisories on May 19th and July 19th in coordination with our public messaging as well. But they shared information about this outbreak and shared just kind of the knowledge that we do have about morels and some of the unknowns as well, to make sure that it was shared with the public and other people interested in food safety. And again, they shared the guidance that cooking can help reduce toxicity in morels. And then just conclusions and moving forward. This was a really large, really sad, intense outbreak. There were a lot of different moving pieces. We had a lot of players in this who were so helpful with the outbreak investigation. But really kind of what it boiled down to is that based on our epi analyses, so the case control study, the food testing of the morels specifically, and product traceback that FDA and other states were able to help with, it suggests that true morels were the likely source of the outbreak. Also suggests that serving the morel mushrooms raw or only partly cooked was a large factor in causing illness in this outbreak. And this investigation really does highlight that there are still remaining gaps in the knowledge of morels in the public health world, medical toxicology worlds, mycology worlds, and that we really do need further research to better understand how it impacts human health. And then just moving forward in Montana. So like I mentioned, again, huge outbreak. This kind of shook up the foodborne disease world. I've never investigated a foodborne outbreak like this. And what is our responsibility as public health to share the message? So continuing to do presentations like this. We certainly have plans for the spring when we know that people are going to start foraging for morels again, to do some press releases, social media notes and everything like that. Messaging to providers. I'm going to plan to put together a web page on the DPHHS website where people could get more information in collaboration with our mycology partners as well. But we do think it is important to share this message on kind of every level of public health, not just the state health department, but also local health departments, federal health departments as well. And we are always open to suggestions. So if anybody has ideas for how they think we should get the messaging out, we'd be happy to hear it. And thank you to everybody who was involved in this outbreak. It really took a whole team, and we could not have done it without everybody involved. So yes, thank you. And I think we should have some time for questions.
We can do questions here in the room and also on the chat. I'll try to keep them right in the chat.
Great.
I'll jump in. Just a quick question. The potential fish component, you mentioned the salmon. Were there sort of concurrent investigations into the Morel mushrooms and the salmon that were kind of starting to go down, and then you decided, let's stick with Morel? Or was it pretty clear right from the beginning that you were gonna just look into Morel?
As with any foodborne investigation, we tried to keep a very open mind at the beginning because it can be easy to hyper focus on one thing and miss the other things. So we did certainly keep an open mind, and we're also looking into the raw salmon as a source. It seemed pretty quickly we found information that, you know, the Morels were likely the suspect item. This specific salmon had been served in other rolls that were served at the restaurant that people ate and did not get sick from. But we did still collect the salmon food specimen for additional testing. But, you know, after ruling out the other most common like fish-borne toxins and illnesses, it seemed pretty clear that this was not a sushi outbreak as we kind of thought initially since it was a sushi restaurant, but good question. Ellen, go ahead.
I just want to compliment you and your team members from just watching this from afar. I thought your public messaging came off, I thought, really clear.
Thank you.
And of course, I'm afar in a couple of ways, but it certainly got attention, definitely. And then I'm wondering, is it likely that the case control study itself is going to be written up, or has it been written up, or possibly published? I'm really intrigued by it because that odds ratio is huge, and your controls and your match are almost 1-to-1. So I'm just wondering about the thinking of, wow, you know, to go with an almost 1-to-1 match, must have known it was probably going to be a pretty big odds ratio. And I would just love to read about that.
Yeah, and Heather, feel free to jump in whenever, but we have, as part of that second press release that we released to kind of conclude the outbreak, we shared it's certainly not an extensive, like full scientific write-up of the case control study, but we shared a like 1-page scientific report where we gave a little more detail about the case control study. We're also trying to put together some reports of this outbreak to share with the wider public health world. So we will, if that gets published, we will make sure that it gets sent out to our
really
public
good
health
for
partners.
students.
Yeah, I think so too.
learning.
And yeah,
Yes.
absolutely. Yes.
Yeah, I have a couple of questions, if that's okay.
Sure.
So first is, you've hinted that people eat Morels all the time, and we don't really see this happen. Is there any thought that it's more than just not cooking them, but was there something in the transport, processing, storage, packaging that could have made this worse or set this on? You know?
Yeah, and I think that's a great question. And I think what it boils down to for me is that the reason, you know, we have no surveillance system for wild mushroom poisoning. The reason that we heard about this outbreak is it was a huge foodborne disease outbreak. We don't often have foodborne outbreaks of this size with this severe outcomes in our relatively small state. So because they were all associated with consuming food at a single restaurant in a short amount of time and became sick very quickly afterward, you know, public health got involved, we learned about it, the public learned about it, etc. I think that it probably is happening more than we know. And I think instead of there being some other factor, I mean, we don't know all that went into the shipping and preparation of these mushrooms. We know a little bit about the cooking method and everything like that, and that seems to be a big risk factor in the outcomes. But I think more likely than there being some other kind of contamination factor is that there are poor outcomes from consuming morel mushrooms that we just don't hear about. Because the onset can be really quick, the outcomes can be severe and happen pretty quickly as well. But if it's just a one-off case, it's unlikely that public health is going to be looped in immediately all the time. So I think what is more likely is that it probably is happening and we're just not learning about it. So that is really the motivation for trying to increase our messaging in the spring, not just to prevent restaurant outbreaks, which of course we want to do, but also to inform the public and put kind of the power in the public's hands, and making sure that they know the risks before they go out and forage and prepare at home.
Yeah, that makes sense. So my other question is, did you notice any trends in the individuals who met the case that and especially about severity of illness? Were older individuals more at risk, or people with comorbidities of existing disease already?
Yeah, and Maggie, feel free to chime in as well. Our public health physician is here. But of those with severe outcomes, we did see some comorbidities in the people who were hospitalized in our deaths. And I think that's probably all I can say. Heather, I don't know if you want to maybe chime in a little bit more on that as well, or Maggie.
Yeah, I think just an important factor with that is we're still talking about really small numbers when we're talking about the people who had severe outcomes, maybe not like percentage wise with the total number of people who got sick, but we had 3 hospitalized cases and 2 deaths. And so we can kind of draw generalizations from that, but on the other hand, it can be harmful to do so with just those couple of cases to draw those big conclusions, if that makes sense. When we have more cases of severe illness, you can kind of compare those things a little bit better. But yeah, I think that's, Rachel, you covered it.
Can you talk a little bit more about the criteria you use to determine if you're going to do an investigation into a potential foodborne illness?
Yeah, and Heather, again, feel free to jump into that on the local level. Maybe I'll let you take a stab at it first.
Yeah, sure. So typically these get reported to us by the patrons who get sick most of the time. Sometimes they can be restaurant reported. It's kind of all over the board, or reported by the hospital, which was the case in this outbreak. So we receive the report, and very promptly the communicable disease team and the environmental health team collaborate. So the environmental health team are the ones boots on the ground inspecting the restaurant, finding out all of the restaurant information and implementing control measures there. And then the communicable disease team is doing all of the follow-up with the cases to try to surmise like what people ate, what the incubation period was, what kind of symptoms people were experiencing. And it involves a lot of collaboration on the local level between those 2 teams. And then also looping in the state really early on is very typical for us, because a lot of the time, it's not something that's isolated to one place or one county. It can, certainly in Montana, people travel between counties very often, and people report illnesses in other counties. So that state collaboration is another huge piece to try to identify if there's cases in other counties as well. But that's kind of the typical follow-up. And it just goes from there depending on the severity of the outbreak.
And I'll also add, like Heather alluded to at the beginning of the presentation, we have a list of reportable conditions in Montana that are required by our administrative rules to be reported to public health. And on that list is outbreaks of any type. So that would include a foodborne disease outbreak. Outbreak can be hard to define, since it really is just like a increase in the amount of disease over a certain amount of time, like a greater increase than you would expect or something. But typically with foodborne outbreaks, we say 2 or more cases of similar illness associated with the same exposure. So 2 cases of GI illness associated with eating food at this restaurant is enough to consider this an outbreak. And not that we necessarily like stopped and we're like, okay, well, now we have 2 cases, so we can investigate it. We were investigating from the beginning, but it easily met those criteria, if that helps.
And I think when there's a particularly severe outcome, like Heather was notified from the hospital directly about this outcome and then was tied fairly quickly to another case with a severe outcome, that's kind of the alarming piece of it, right?
It is very alarming. That rarely happens, and we knew within a couple of hours of each other about these 2 severe outcomes. So.
How do you learn about the other people that got sick? Do they self-report, or is that where the investigation comes out once you know where they got sick and start reaching out to the community?
Yeah, so Heather can add to this more as well, but we got a lot of, if you eat at a restaurant, like Heather mentioned, you're always gonna, and then you get a GI illness, you kind of always blame the last place you ate, whether that's true or not. In this case, it certainly was true. So people ate, got diarrhea, they're gonna call the restaurant and let them know, especially if they ate with another friend. That's the only food that they had in common. They want to, have someone hear them and hear their pain and let the restaurant know that they potentially made them sick. So we got a lot of our initial reports that way. Then once it started getting a little more media attention and the community started hearing about it, we got direct calls to the local health department. And then there was just a lot of chatter on Reddit and Facebook and everything like that. So the more it got out there, the more cases we heard about. But yeah, it certainly, we heard about cases before this was released in the media or anything like that.
Yeah. And the only other way that we got cases that Rachel didn't mention already is a lot of the time when we're doing those investigations and interviewing people, they will identify other cases and give us contact information for those individuals. So that was another piece where we were able to identify additional cases.
Jim, are you tracking the chat?
Yeah, we do have one comment, great presentation. And then also that farmers markets would also be a good place to get your information out.
Yes, that's true. That's a great suggestion. I know, especially the Missoula Farmers Market does some Morels. Yeah, some like 1-page handouts. Okay, I'll write that down. Thank you.
Any other questions? Thank you.
Thank you, everybody.
Thanks for coming over.
Of course, no problem.